The Philippines has a contraceptive prevalence rate of 55% based on the 2013 Philippines National Demographic and Health Survey. Most contraceptive users rely on modern methods, but over the past 10 years, traditional method use has continued to comprise about a third of all contraceptive users in the country. So, why birth control is very important today and why birth control is good in society? In general, pregnancy planning and the use of birth control in particular are directly linked to broad benefits for women, men, children, and society, including reducing unwanted pregnancies and abortions, increasing educational and economic opportunities for young women, and improving maternal and child health. Young people are especially at risk of problems in pregnancy. Contraceptions allows them to put off having children until their bodies are fully able to support a pregnancy. It can also prevent pregnancy for older people who face pregnancy-related risks. Birth control methods provide benefits such as more predictable, lighter menstrual cycles and decreased risk of sexually transmitted infections or a reduction in the risk of some cancers. If these benefits are important to you, they may influence your choice of birth control option.
First, we have a trust pills. Trust contraceptive pills is indicated for contraception and treat of menstrual disorders such as dysmenorrhea, premenstrual syndrome, and menorrhea. One pack of these contraceptive pills to be taken for 28 days costs around 50 pesos to 55 pesos. What are the difference between the colors of birth control pills? These pills come in different colors because each color contains a slightly different amount of hormone. Make sure you take the pills in the correct order. For maximum contraceptive effect, trinesa must be taken exactly as directed, no more than 24 hours apart. Are trust pills effective? If you use it perfectly, the pill is 99% effective. But people aren't perfect, and it's easy to forget or miss pills. So in reality, the pill is about 91% effective. That means about 9 out of 100 pill users get pregnant each year.
Second one is a condom. A sensitive, strong, and reliable condom highly effective in preventing unwanted pregnancy and the transmission of sexually transmitted disease, including HIV/AIDS. Trust condoms are sensitive, strong, reliable, and lubricated for comfort. Condoms are super easy to get from many different stores, community health centers, Planned Parenthood health centers, and online. You don't need a prescription or ID to buy them, and they're inexpensive or sometimes even free. Condoms are small, discreet, and portable way to get big protection from pregnancy. A condom 100% effective. When used correctly every time you have sex, male condoms are 98% effective. This means 2 out of 100 people will become pregnant in 1 year when male condoms are used as contraception.
The third one is intrauterine device or IUD. Contraceptive device or coil is a small, often T-shaped birth control device that is inserted into the uterus to prevent pregnancy. IUDs are one form of long-acting reversible birth control. How does an IUD work? The copper-coated IUD prevents pregnancy by not allowing the sperm to fertilize the egg. It may also make it harder for a fertilized egg to implant in the uterus. An IUD coated with progestin works in a similar way, but also thickens the cervical mucus and thins the uterine lining. Is IUD effective? IUDs are safe, effective, and convenient for nearly all women, including adolescents and patients who have never given birth. An intrauterine device is a long-acting reversible contraceptive method that is a convenient form of birth control for many women.
The fourth one, Depo-Provera. Depo-Provera is well-known brand name for Major-C progesterone acetate, a contraceptive injections that contains the hormone progestin. Depo-Provera is given as injections every 3 months. Depo-Provera typically suppresses ovulation, keeping your ovaries from releasing an egg. Is Depo shot good for birth control? Depo-Provera is 96% effective in preventing pregnancy, which means that about 4 unplanned pregnancies will occur out of every 100 women every year. Women at greatest risk of accidental pregnancy while taking the birth control shot include younger women, such as adolescents, teens.
The fifth one is the contraceptive patch. A contraceptive patch, also known as the patch, is a transdermal patch applied to the skin that releases synthetic estrogen and progestogen hormones to prevent pregnancy. So is the patch a good birth control? If you use it perfectly, the patch is 99% effective, but people aren't perfect and it can be easy to make mistakes. So in reality, the patch is about 91% effective. That means about 9 out of 100 patch users get pregnant each. So the better you're about changing your patch on time, the better it gonna be work.